nani na kupeleka Mombasa sasa, ambapo kongamano la pili la taasisi ya kitaifa ya Uanishaji wa uchunguzi wa sera za umma linaendelea jijini Mombasa, na ajenda kuu ikiwa ni masuala ya jinsia katika maendeleo ya taifa. Kongamano hili litafunguliwa rasmi na mkewe Naibu Rais Rachel Ruto. Zaidi ya wanaohudhuria pale washiriki ni 500. Hebu nikupeleke kule moja kwa moja tufuatilie kinachoendelea kwa sasa kwenye kongamano hili.
Kept the white people away from Western Kenya to a certain extent. But Dr. Josiah has just completed on the question of children who are at home. But we also have a growing number of children who are on the streets. Children who are child-headed households and so on. Research shows that these numbers are increasing. And every so often when there's a big conference in Nairobi, the county government goes and rounds up those street children and goes and hides them somewhere, and then after the conference they come back onto the streets. The question is, who takes care of these children? Who enables them the way that NHIF is enabling some of us to access healthcare when they don't belong to fixed households where they don't have fixed incomes or anything that can allow them to access the kind of healthcare that they themselves might need. And I would like to ask Lucy, because you work with children, what are some of the challenges and what are some of the solutions that you could propose in terms of handling children in that category? Besides the children who are at home, who are not in school, what about the children who are in street families, for instance?
Brilliant. So thank you for the question. I'm the founder of Total Care Box, and what we do as an organization, our mission is to protect, preserve and promote the health and well-being of newborns in the first 28 days of their lives. So what we do is normally we introduced a new, it's an old innovation that we got from Finland. Finnish babies have been sleeping in card boxes for over 85 years, and because of this box and the items that comes in the box, Finland has the lowest deaths in moms and newborns. So what we decided, we thought, why not introduce a similar box, but contextualize it to the needs and the wants of mothers from poor, marginalized and underserved communities, as well as for their newborns. So by introducing sort of simple innovations that maybe we can borrow from, outside Kenya, and we can do like pilot studies and feasibility tests to actually see if they can have the same results or outcomes, especially in this journey of reducing maternal and newborn deaths. So I feel it's our moral responsibility for each and every person to actually, women and mothers should not die, mothers should not die during childbirth, because you find, as I said, our passion is really maternal and newborn health, and you find when a mother dies, normally the newborns of these mothers actually die too. Then you find the children of the surviving children are left desolate, and we miss out a lot on what this mother could have actually contributed to the community. So the innovations that we're very passionate about, they deal with accessibility, acceptability, they also deal with quality of care. Because the mothers that we actually support for the newborns are the mothers who cannot even afford a cotton wool or even baby clothes. We've had those situations, people who work in the health professional, where a woman will come and give birth and she will use maybe a piece of cloth that she had, or maybe a lasso. So we are trying to bring back dignity in the maternal and newborn health field by providing these newborn survival kits that come with all these essential items that a mother will need for the first 3 months of the baby's life. And also the box itself, it provides a perfect place for a baby to sleep in, because the mothers that we support, they live in very tiny 10 by 10 households, and the average number of people, like where we work in Mukuru, average number of people where a newborn sleeps, or rather a household where a newborn is 7. Then the average number of people of where a newborn sleep is actually 4 or 3. And then adult netting is not conducive for a newborn. Yeah. So we really we like working with the grassroots women. We go to the people, and that's another innovative way we can actually deal with people. We can all sit here, but we don't live in a 10 by 10. But if we actually involve these women really and understand their challenges in sort of newborn care and maternal care, I feel like we can go a very, very long way in this journey.
Thank you. That still leaves us with this question of what do we do with the street families? Because this is an emerging problem, it's a real problem. We know that we declared universal free education, but when you walk around our towns, when you walk around our countrysides and so on, you see a lot of children playing on the streets because they're not in school. Some of them are not within any households. So that still leaves us a question of how to make sure that we take care of some of these children that are unfortunate not to be pegged down anywhere. I'd like now to go to the Nursing Council, and I know that a lot of reforms are taking place in the country, but a lot of the studies that we've done, a lot of the surveys that we've done have come to the conclusion that to a certain extent, the nursing institution is an impediment to healthcare access. International research shows that nurses can actually handle 70% of what doctors do. That in 70% of the cases that come to a health facility, nurses can actually do what doctors would eventually do. It's just that by law they're not allowed to do some of those things that they do. My own cousin, when he became a medical doctor, the first time he handled a complicated delivery, he got a panic attack because he didn't know what to do it. He had not been taught in the classroom. So it is the nurse who was with him who told him how to go about handling the crisis delivery that he was faced with. One of the complaints that mothers make to explain why they don't attend antenatal clinics and why even when they attend antenatal clinics, they eventually don't go and deliver in a health facility in the hands of a professionally trained birth attendant, is that nurses can be very hostile. I know that you've heard this complaint over and over again, and I've had a lot of explanations of the dynamics of these complaints and so on. What is the Nursing Council doing to eradicate this complaint, to minimize the extent to which there's a perception that if I go to the facility, the nurses are going to harass me, so let me just struggle on my own? Just recently we saw something about a mother who used a razor blade to do a cesarean on herself. I think just last week on the internet. So what is the Nursing Council doing along those lines?
Thank you for that wonderful question. I'll first say that when I did my presentation, I spoke about the nurse and the midwife. Midwife is someone who actually delivers a mother. And there are three dots that we really need to be able to connect in terms of the expectations of the public, and perhaps that is also what Chantel's actually in the perspective actually required, that we should be able to get this care, which is, we are more of caring, we are more able to be able to give a compassionate care, and at the same time we are able to be able to do the connecting.
Na tutakuwa tunarudi baadaye kule Mombasani kufuatilia kongamano hilo punde mke